Imagine a disease so terrifying that even doctors were afraid to touch patients. In 1981, a mysterious illness began claiming young, healthy lives across America, and nobody knew why. This was the beginning of the AIDS crisis, a devastating epidemic that would reshape society forever. In major cities like New York and San Francisco, young men started falling ill with rare cancers and infections. Doctors were baffled. These patients' immune systems seemed to simply vanish, leaving them defenseless against diseases that healthy people could easily fight off. By the end of 1981, 121 people had died from this unknown killer. Fear gripped communities as rumors spread. People avoided touching, sharing utensils, or even breathing the same air as those infected. Children with AIDS were expelled from schools. Healthcare workers quit their jobs rather than treat AIDS patients. The silence from government officials was deafening, as President Ronald Reagan wouldn't publicly address the crisis until 1985. The gay community, hit hardest by the epidemic, mobilized in the face of widespread discrimination. Activist groups like ACT UP formed, demanding government action and increased funding for research. Meanwhile, the death toll kept rising. By 1985, more than 12,000 Americans had died, and the virus had spread to every region of the world. The discovery of HIV as the cause of AIDS in 1984 marked a turning point, but effective treatments remained years away. Desperate patients tried experimental drugs, often with devastating side effects. The epidemic exposed deep social prejudices and healthcare inequalities, as minorities and poor communities struggled to access even basic care. Rock Hudson's death in 1985 finally brought AIDS into mainstream consciousness. The iconic actor's diagnosis shocked the nation and forced Americans to confront the reality of the epidemic. Other celebrities like Elizabeth Taylor became powerful advocates, helping break through the stigma and silence. The crisis transformed how we think about disease, healthcare, and human rights. It sparked unprecedented activism, revolutionized patient advocacy, and changed how new drugs are tested and approved. By 1989, over 100,000 Americans had died from AIDS-related causes, leaving a generation scarred by loss. The epidemic taught us harsh lessons about the cost of prejudice and inaction. It showed how fear and discrimination can be as deadly as any virus. Today, while HIV remains a serious health challenge, the dark days of the 1980s stand as a powerful reminder of our collective responsibility to fight both disease and discrimination.